various areas to speak on this topic as well as the implication of our lockdown. Join me as I welcome our own very own family of the house, a friend of the house, Dr. Kechi Obago. Nice to have you.
Always a pleasure to be here.
It's our pleasure, really. You look resplendent. I don't think you're bothered at all by what's happening.
Well. You will hear me when we talk, and you will know whether I am or not.
I know. And we have a chief nursing officer here with us in the person of Mrs. Ruth Husseini.
Thank you. Nice having me. Good morning.
All right. So before we continue this discussion, you know what we do here. We take a break. When we come back, we kick it off right away.
This is not a joke. It is a matter of life and death. Mosques in Mecca and Medina have been closed. The Pope celebrated Mass on an empty St. Peter's Square. The famous Notre Dame Cathedral in Paris held Easter Mass with less than 10 people. India, Italy, and France are in complete lockdown. Other countries are in the process of following suit. We cannot be lax.
All right, we just saw a little bit of what the Mecca, the Medina looks like, and of course the Vatican, a place that used to be, full of life, full of activity, is, if I say virtually empty, it will look as if I'm exaggerating. It is empty, and it's amazing that people are still asking questions, because I'm looking at the iPad here, and feedbacks we've been getting within the week. Some people are asking us, is COVID-19 real? And I'm like, seriously? I need you to speak on that.
Thank you so much. I had hoped actually to start from there. I think, as I had said before, when I had the privilege of being in your program, that we're in a state of war. A war that is more serious than the Third World War could ever have been. And more dangerous because it's unseen. Our enemy, we can see it. The COVID virus is so real. And there's evidence everywhere. When you look at Spain, Italy, China, America, the UK, name them, they've never seen such a catastrophe. And we should never, for any reason, think we're exempt from that. There's no reason why we would be. It is so real. And let me say to my fellow Nigerians, having watched, perhaps in a way, had a little advantage of watching what is happening in those parts of the world. Mm-hmm. We know what we should be doing, and we also know what we should be expecting, and what is probably already happening to us in Africa. From the trajectory of the disease in these other countries, that is still very much ongoing, there are critical things we must do. We must test. We must find the cases, isolate them, treat them. We must contact trace so that we arrest the infection in all the other people in the population. We recognize our limitations. We know how weak our systems, particularly health systems, were and still are before this. But to be able to do those critical things, we need time. We must buy time so that we can improve our testing facilities, so that we can have measures in place to treat the cases when they begin to erupt, because they will. We pray, I believe a great deal in prayer, but it will happen, because that is the natural transmission pattern. While all these things are being done, We must buy time. We buy time by the lockdowns, by the isolation.
You know, a lot of Nigerians have reacted to the lockdown, and a lot of us are not happy about it. I'm glad you're explaining, you know, the necessity of the lockdown. We'll come to look at, you know, some of the things we can actually engage in at this point. But let me speak with the nurse here, Nurse Ruth. I always say that nurses are a bit scary to me because they always come with injections. But today you're not carrying injection, you're carrying a lot of other things. And these are the things I want to talk about. The doctor has just told us that we must do the necessary things to ensure that we control the spread of this virus. Now, in doing this, a lot of things has been said about the face mask and the gloves. Talk to us. I've seen different types of, can I touch it?
Yes, you can.
Okay, I've seen different types of. This one looks like the one you used to go to the space because I see something polythene bag here. So what do you do with this? How do you wear it?
Yeah, in the realities of life, just as my able doctor have just spoken, if the reality of this COVID-19, you know, come in place in Nigeria, the way it is all over the world now, you will find out that certain times you will see people even using these water dispensers to cover their faces.
The water dispenser,
Yes.
plastic.
Yes, plastic.
We'll get
They
to a
will
point
do
where
it.
we'll use it to cover our
Get to
faces.
a point where you have to use it.
Wow.
And so,
Wow.
this is 2 in 1. Because we are told not to touch our faces, nose, and eyes. So by the time you use this 2 in 1, you are protected. That is one out of many in terms of facial mask. And there are some other types of mask too, that even a lot of people, those that are even, you know, trying one way or the other to use it, though they are mocking themselves because they don't believe in COVID-19, they don't even believe that COVID-19 is real. You go on the streets, on social media, you hear people, Auntie Koro, Mr. Koro, Dr. Koro, AYZ Koro. They don't even believe in it. And so a lot of them don't even know the uses and how to use mask. Most people we meet on the roads, in the market space, in the marketplace, they use it wrongly. And at one time or the other, we stop to talk to them about it. Though some of them will gladly say, oh, we are sorry, we don't know how to use it. You talk to them, they are happy.
Now you talk about the usage. What's the proper way of using it? Because I'm not even sure I know how to use it.
All right. And I want to demonstrate.
This is the regular one, okay?
Yes.
Somebody told me the green should be inside.
Yes,
Why?
and the white outside.
Okay, why is that
Sorry,
so?
can I pick a new
sure.
one? Okay, because this one is
So I'm still interested. Why is the green inside
Yeah.
and the white outside?
yes, this green. This is the filtering aspect of it. We have filters here.
Okay.
That is what is being said. There are filters here. And why it is designed this way is the filters go to the infected person.
The filter goes
Yes, to the
person.
infected person.
Okay.
If I wear the filter, if this green happen to be outside now, it means that I'm already infected, and I won't like the infection to get to other people.
Oh.
Yes. Then by the time I wear the green colors inside, it means that if anywhere I go, for example, that I happen to be infectious zone, it will not get to me because of the filters. The filters might have filtered such magnitude of infection, and maybe or maybe not, it will not be permissible to get to me.
To you.
Yes. But you see people wearing it wrongly, anyhow, upside down.
I'm one
It
of
is
the
not supposed to
culprits.
be.
Sometimes I do it wrongly. I just know I'm covering my nose. I never knew. And you can actually tell a story with it. If you wear green, you're telling
Yes.
people you're already infected.
Yes.
Then if you put the white, you're telling people I'm
you-
clean, but I just don't want to be dirty.
Yes, you don't want to
Okay.
be dirty. You don't want others to infect you.
Okay.
And that
So
is
I
what
see
it
a lot of
is.
people when they wear it, sometimes they want to talk or eat, they pull it down to the jaw and eventually pull it back. What are the consequences of doing that? Is it healthy?
It's like when you want to visit the toilet and you come back, clean your hand, you wash off with soap and water, and you rush back again to go and touch the toilet seat. That is exactly what it represents. If you wear mask, it's a within a space of 15 minutes. When you touch, you should be able to discard. But before now, a pack of mask is about 1,500. Now it has gone up to 15,000 naira, and so people even believe going to possibly, use wash and reuse, which is not possible by all standards.
All right, it's good we know that. We'll come to I see hand sanitizer as well. We'll get to speak on that. But let's go to Doctor again. Doctor, you talked about the lockdown, which is one of the ways experts like you say we should use to curtail the spread. But yeah, and I like particularly what the Katsina State is doing. He said he's going home to fish out the visitors that visited the states. Whether it's from outside Nigeria or Lagos or Abuja, wherever he came from. So he's going house by house to fish them out. And he can only achieve that with the lockdown. But with the lockdown too, a lot of people, I read this, there are a lot of messages, but I tell you, 80% of the messages are centered around the palliative. I need you to speak because I know you have passion for modalities of ensuring that the palliatives are well done. Speak on it for me.
Thank you so much for the opportunity. Today, I don't know, I'm going to disgrace you because my heart bleeds.
Disgrace me?
Yes.
Oh, God.
By not being the composed person you usually interview, by being emotional. My heart bleeds. I started by explaining why it's imperative that we lock down, why it's imperative that we stay home. And yet, I know how incredibly difficult that is on the people. So many people have reached out. I have heard the cries. A large proportion of our population are poor. It's a sad and tragic reality. But in addition to the normal poor in Nigeria, a large proportion of the population depend on daily wages. The things they do every day to earn enough to feed themselves and their families. And so in the lockdown principle, we have doubled the size of the poor. All those people who go to the market, who sell on the streets, who have small businesses and so on, from which they make the money to feed themselves and their families. In locking down, you've stopped them from functioning. Many of us, of course, don't have savings. That's why we're poor.
But of course, we need the lockdown to control the spread.
But we need the lockdown to control the spread. And that's why my heart bleeds. We must give them palliatives. For the lockdown to work, we must help them to feed. And that is what I want to address today. I'm somebody who believes in not just acknowledging that a problem exists, but trying to find solutions to that problem. And so the things I will say today are some of my own ideas. I have also talked to friends. I acknowledge many of them. I thank them because they shared their own thoughts on the issue. But Elizabeth, my dear, we're sitting on a time bomb. People are desperate. People are hungry. The lockdown will only work. We don't want it to work at the cost of social unrest, nor do we want it to work at the cost of people dying from hunger. So we as a nation must come again together. A recurring theme in my talks to you before has been the issue of joint ownership,
Yes.
coordination at every level, recognizing the fact that this is our problem. It isn't just the problem of the civil society, of the family, of government. It is a joint fight for survival. And therefore, in everything we do during this pandemic, it has to be in that spirit. We need now to turn urgently to effective palliation for the thousands and millions of Nigerians, sisters and brothers out there.
When you say effective palliation, what does that mean?
To my mind, there are two or perhaps three major things that is urgent, that we must start doing like from yesterday. It can't wait. One is increase the extent of what is already being done in terms of palliation. So expanding that support. The other is to make the support more effective. It must be done in an efficient manner so that it gets out to many more people, and so that people also, as they see it, begin to have confidence and hope, and therefore be in a position to actually wait and stay at home as we request of them. So I would address it from those two angles.
Okay.
Expansion, and by everybody. At every level, federal, state, local, community, everybody. In this fight, we must be our brother's keeper. That is the only way we will survive. Anything else will not work. Let me start. I won't dwell too much on the federal level because that's been done extensively. The president himself addressed us. But let me say that I was very pleased. I don't know whether it was yesterday or 2 days ago.
2 days ago.
When I heard the Minister for Humanitarian Affairs say that she's handed over the food distribution to the states. The states need to take the leadership in this. They know their people best. They know the structures on ground that can be most effectively used for the distribution.
Some states are actually doing that. I'm aware of that.
Let me use this opportunity, even before I go any further, to acknowledge the many, many wonderful efforts already out there, already being undertaken. Many of the states have shown great leadership. I am proud of the efforts they're making. They have opened stores, they're doing all kinds of things. Sorry if I talk again about Lagos, but because they have the largest problem and they're perhaps doing the most, not only do they have food stores, they have also started funding restaurants to produce food for people, cooked food for people to eat. That's the kind of, things we're talking about. So states to really coordinate this effort. The states, there are two groups of people, to my mind, that need this support most urgently. Everybody needs support. I'm not saying that they don't, but two urgent groups come to mind. Let me deal with the easier one first. At the state level, with the state coordinating things, the states, the LGAs, and then within LGAs, the wards and the communities. For many, many of our communities in this country, they have community leaders. They know who is poor within their communities. They have women leaders. I particularly advocate for women to be a part of this. Women are often the people that bear the brunt of feeding the family.
Exactly.
And looking after the children. Women need to be part of it. So within each state, within each LGA, within each village and community, a core group that is responsible, coordinated and harmonized, that is responsible for the feeding, for the palliatives, and would know who therefore needs this help most. I think that is fairly straightforward. I am, however, particularly concerned about the urban poor. And the disease is worse in two of our biggest urban areas, Lagos, urban states, and the FCT. We have a huge number of urban poor, people who reside in high density areas of our FCT, for instance, where the structures are less distinct. But even at that, they have senatorial areas and zones, they have wards that can be used. These wards need to come into it and coordinate the efforts of wonderful organizations out there, the various religious groups, the various civil society groups, and some of the private sector who are also pitching in to provide palliatives. But it must be coordinated.
Coordination is key.
Coordination is key for several reasons. It will ensure that nobody is left out. We cannot afford to leave any particular area out. If we coordinate, then we don't duplicate efforts. It must also be regular.
Yeah, very important.
I would say at least twice a week. If people feel confident that at least twice a week people will come to give them food or whatever support, then the panic will decrease. They will comply, they will stay in their homes.
All right. You know, what you were saying, what you said, it got me, it just reminded me of a conversation I had over the weekend. I tried to speak to a lady, and it wasn't possible at the time. Eventually, when we got talking, she said, I went to the city center, the area council, to share our food. And I was like, what food? He said, you don't know. You people don't have in Abuja. This is the fourth one we're sharing. And I said, talk to me about it. He said, different people have been giving us food. This one is from our governor. You know, he gave us rice, tomato. She took time to mention a whole lot of things. And I was happy. I said, he said, it's not the first time you're sharing. She said, this is the fourth time. And that in their village, they have some young people in age grade system. And the different age grade has been giving them food to make sure that all the women in the village, get food, be it widow, be it single mother, whoever you are. In fact, the more indigent you are, the more they give you. And that incidentally, that she has so much rice in the house now, she doesn't know what to do with it because she's collected a custard bucket 4 times. I said, lucky you. I wish it was possible you'd have sent me some of the rice, because I know what to do with it. I have a full house. So, but it got me thinking when she said, youths of a community gave us food. The ones that are handy contributed money and gave us food. The age grade gave us food. I'm talking about Abriba. The age grade gave us food. Our traditional ruler gave us food. The government via our church, she's Presby, gave us food. That's the 4th one she counted. So I think beyond just the government, what you're saying, communities should gather around. Like I always tell people, if you can try to feed 2 mouths, that's 2 families when I say mouths, around your area, you take away hunger on daily basis, and it may not cost too much if you're that rich. So I think communities should get involved, like you've always advocated, and ensure that these things are constantly done on a regular basis.
On a regular basis, coordinated, so that we map our efforts. The various communities, people providing support, take on certain areas so that we don't duplicate those efforts, dump too much food on certain people, but also importantly that we know those who are really most vulnerable.
Yes.
The widows, the really poor households, and so on, and that they get. But regularity is important. It's not a one-off thing. It has to be, for them to continue to stay at home, they need to know that at the very least once a week, but I advocate more than once a week, that they will come back. And my team and I did a little research, trying to interview people virtually, of course. We didn't contaminate it. We didn't.
I was going to ask you.
And overwhelmingly, in the high density urban areas, poorer areas in Abuja, what we heard is that they preferred door-to-door distribution.
Yes.
They were very unhappy about being this field coming together, no matter how much you're trying to social distance and the hours that take. They pleaded for door-to-door, that they will stay in their home. the people distributing will come and drop whatever quota is theirs, door to door. And that is possible because all of those areas have heads, and so on, that know who is who. We come, the aids, the palliative groups come with their stuff in a big vehicle or something and go around and drop it for them in their home.
All right, we will be continuing with your palliative talk because I know that's your baby. But somebody asked me a question when we started. He said, what is the difference between this, that is watery, and this, that has color? I will take that question back to the nurse. But before we do that, we're going to take a break. When we come back, you will have to explain to us if there is difference between this, and of course their uses and how it can be used. For now, we'll take a break. Don't go away.
In the midst of the coronavirus pandemic, information management is key.
I'm Cyril Stover.
Fatima Umar Buba.
Joseph Johnson.
Ian Ray John.
Muhammad Kudu Abubakar.
Jumbo Yusuf.
My name is Kirian Umayo.
Here in NTA, we're working very hard to make sure that everything we broadcast is accurate and up to date. Misinformation spreads very fast.
The social media has been a huge conveyor of misleading information from one individual to another, then to another set of groups. In a short while, it goes viral, and before you know it, it is all over the world.
There have been several misleading information on coronavirus COVID-19. Recently, the misconception of 5G as a cause of coronavirus is becoming widespread. Another is the belief that hot beverages and alcoholic drinks are internal cleanser for COVID-19, thereby leading to excessive consumption of these drinks.
The use of local concoctions as treatment for COVID-19 are yet to be scientifically proven. However, there has been several theories about the efficacies of these concoctions. We should stay safe and denounce all manner of fake news and misleading information on COVID-19.
For medical advice, go on the WHO website, Nigeria Center for Disease Control, NCDC website, or stick with the advisories from the Presidential Task Force on COVID-19 or other authentic official sources. NTA is one of them.
Coronavirus, where the nickname na COVID-19, it not be big man who sickness, so if it catch anybody, according to World Health Organization, WHO, where then they call WHO, make I show you how the disease they take spread.
Oga travel go abroad, come back with symptoms of COVID-19 infection. As he land for airport, driver go carry and come house. His wife and pikin welcome am. Cook arrange food for Oga. Houseboy and housegirl pack Oga load enter house. Now so Oga begin spread this infection to him people. Driver go mechanic workshop, go spread am. Cook go open market to go buy one or two things. She go spread am too. Even house cleaner go back her house, go spread the same infection. Now so this coronavirus begin take style dey spread from family to we country people.
So therefore, make we join hands, obey all the instructions wey government and our medical people don't give us. So wash your hands with water and soap regularly, or use hand sanitizer. No go join body for where people gather plenty. Maintain social distancing. Above all, stay in a house as government don't advise. Stop unnecessary waka about. So make we not spread this virus. Coronavirus. No be only big man like me they catch you. If it catch anybody, even poor man yourself if it get am. So make we join hands together. Take stop with this deadly disease where they kill our people and they never get a cure. Together, we go overcome if we do all the things where they tell us to do.
All right, I'm sure you got the message. Coronavirus is not discriminated and is not partial at all. Actually, it's a bit partial. The partiality comes in when you decide to keep your hygiene. So he's scared of clean environment. He's scared of your hands when they are clean. So that's the partiality in it. But talking about hands, we started by saying that you have to explain these things on the table. Somebody told me that there is something that government and the churches have been preaching, that they should rub it as body cream. You take your bath in the morning and you apply it, you know, and in the night when you take your bath again, you apply it, and then nothing happens to you. I said, what's the name? She said she does not remember. It was actually a phone conversation, but by the time I probed a little bit, I found out it was hand sanitizer. No, it happens. That's how much we do not know, you know, in Nigeria. Talk to me. This is hand sanitizer as well.
Yes.
But this is different from this one. So what's the difference?
The difference is just because of this moisturizer and the color.
Oh, okay.
If not, they serve the same purpose.
It's the same purpose?
Yes, the
now,
same
the
thing.
woman I spoke with said she was told to rub it all over her body in the morning after bath, and then bath again in the night and rub it. Is that the right usage?
No, that's not the right thing. I think it's out of ignorance.
Okay.
And a lot of people, you know, media diarrhea. A lot of people go
Media
on,
diarrhea?
Yes.
Wow.
A
I'm
lot
hearing
of
that
people-
for the first time.
A lot of people go on air
I'm hearing
and
that
say
for the
what
first
does
time.
not exist. They go to say what does not exist. People just sit on their own. They will think one plus one. They go on air and blow it. I think that is exactly what happens in the, you know, in the church, or I don't know where possibly they've asked this group of people to start bathing and then use hand sanitizer all over their body. What we are told is by WHO worldwide that is accepted is two ways. Is either you use liquid soap and wash the hand under running water, or you use hand sanitizer, especially in a workplace like hospitals, where, you know, like hospitals, like airports, you know, just from the little thing we have just seen here. People, you know, these are areas that you can easily use hand
The sanitizer.
sanitizers without running helter-skelter to go and look for where you can get running water to wash your hands.
But if it's possible, water is always the best. And it has to go with soap, right?
Yes, liquid soap.
Okay.
So because if you use a tablet, the possibility of another person going to, you know, to take whatever, like an infection, you know, if your hand is infected, you go pick the tablet, after washing, you drop it, another person picks it like a chain. You know, instead, I mean, to break that chain, it is better use liquid soap and the hand sanitizer if possible. If you can afford the two at the same time, why not?
Okay. There is another thing I observe. People these days wear hand gloves even on the streets. And we wear it as we dress up in the house, like I wear my jewelry and all that. So I wear my hand glove. I drive with it. I do everything with it. And then at the end of the day, does it really guarantee protection? Am I doing the right thing? How should we wear hand glove? How should we use a hand glove?
Well, hand gloves, if not because of this COVID and the way we see people doing it in the developed countries, a hand glove is not something that you just wake up overnight and start thinking of how to use hand gloves. Even in a hospital setup, there are a group of people that use hand gloves. It's not everybody on the street of hospital walls, clinics that goes about using hand gloves. What I would have loved to demonstrate how to use hand glove.
Hand glove.
Yes. You know, the way to wear it and the way to, you know, to discard it.
Okay, so maybe we'll have to get one
Yes.
before the end of the program.
I can
So
add to that in terms of
I
the
think-
question, if you don't mind.
okay, you were going
Sorry.
to say something.
Yes, about the hand
I think
gloves.
I have
Okay.
it in my bag.
You were saying something.
No, just to say that in answer, you know, in supporting my sister here, in answer to your question, people in this period of COVID-19 are afraid and want to protect themselves by wearing hand gloves. It's not the best thing, but it could be useful as long as you're careful, because the gloves pick up the virus, and therefore, if the gloves get to your own face and so on, you still transpire it. So, but what the hand gloves could help in protecting is that your skin itself doesn't come in contact with potentially contaminated areas. But you must be very careful that as soon as you finish the potential exposure that you are trying to protect yourself from, you remove them carefully so that you don't contaminate yourself when you're removing the hand gloves, and you dispose of them carefully. So that is the thing about hand gloves. So people shouldn't think because they're gloved, they're totally protected. The gloves still pick up the virus, and it's still possible for you to contaminate yourself with the virus.
You know, I keep wondering if I wear hand gloves, sometimes I'm culprit. Okay, I'm actually telling about myself. I wear the hand glove, especially when I'm going to the grocery store, and I do all my pickings and drop it. When I get to my car, before I get in, I put the hand sanitizer on the hand glove and rub it all over, then discard. I'm not sure if I'm doing the right thing, you know. Is it okay to do that?
You know, you're going to get to your car, you're going to touch your car handle with your glove before you get into your car to put your hand sanitizer, right? So
no, the hand sanitizer, I carry it outside.
Outside?
Yes.
Okay.
Before I even touch the door handle.
Okay, so it may be better to actually remove the gloves and dispose of them. Not even an issue of sanitizing them anymore, but carefully remove it, carefully dispose of it, and then go into your car.
Okay.
Might be a safer way to do it.
Possibly sanitize your hand.
Yeah, and then sanitize your hand.
If I pull it, I must sanitize my hand before I get it done. Okay, that's a good one. We'll take a quick break now. When we come back, I think we'll have you demonstrate how to use the hand glove.
All right.
When there's a child out there that's not getting the same that your own child is getting, the difference will tell, and there will come a time in the society where that child is going to take its pound of flesh.
Where you can actually, everything from watching a program with the child, you can start up the conversation from something on the TV and say, oh, you know.
For me, it's like, hurry up with this business. And the other one said, Auntie, it's not about me, it's about the guys. They're not ready to marry.
Yes. If she wants to ask something, no, I know my mother very well. In fact, the most interesting one is when I put up pictures on WhatsApp, you know, Snapchat filters and all that, she will call me, remove that picture. There was a day I got tired of all that, and I
Coronavirus, where the nickname na COVID-19. It not be big man who sickness, so if it catch anybody, according to World Health Organization, WHO, where then they call WHO, make I show you how the disease they take spread.
Oga travel go abroad, come back with symptoms of COVID-19 infection. As he land for airport, driver go carry and come house. His wife and pikin welcome her. Cook arrange food for Oga. Houseboy and housegirl pack Oga load enter house. Now so Oga begin spread this infection to him people. Driver go mechanic workshop, go spread them. Cook go open market to go buy one or two things. She go spread them too. Even house cleaner go back her house, go spread the same infection. Now so this coronavirus begin take style dey spread from family to we country people.
So therefore, make we join hands obey all the instructions wey government and our medical people don't give us. So wash your hands with water and soap regularly, or use hand sanitizer. No go join body for where people gather plenty. Maintain social distancing. Above all, stay una house as government don't advise. Stop unnecessary waka about. So make we not spread this virus. Coronavirus. No be only big man like me they catch you. If it catch anybody, even poor man yourself fit to get am. So, make we join hand together. Take stop with this deadly disease where they kill our people and they never get a cure.
Together.
Together, we go overcome if we do all the things where they tell us to do.
All right, when we took our break, we said when we return, we will be demonstrating how best to use the hand glove. Maybe you can show that to us. I notice you're removing your jewelry, so
Yes.
before I wait, I must...
Quickly, yes, you must remove all this because
before
they
wearing
can harbor a
But I actually noticed
microorganisms.
one of the times I wore my own, before I knew it, my ring, gave it a blister, and from there it began to tear away. So this makes a lot of sense.
Yes, you have to remove them.
Okay.
One, for the purpose of not picking any microorganisms right into, right in there when you are wearing your glove.
Okay.
In the first instance, gloves are not what you just wake up overnight and start thinking of how to wear gloves. Even before you wear it, if you are not, no matter how careful you think you are, you must have the knowledge about wearing glove because it has a principle of wearing it. You understand? And for example, if I went to wear glove, this is how I picked it. And you can see, if you see the design of the glove, it goes this way. And so my wearing the glove is straight. I'm going to wear it without touching any of the edges. And now, sorry, this is torn, but I might discard this and use another one.
Standard.
Because of the nature of this type. So you pick it and then straight in there.
Okay.
You wear your glove, you wear it, and you are done with wearing a glove with the right hand, as the case may be. And then you pick the second one with this. I can touch any part of the glove now because I've already protected my hand.
Okay.
So, wearing this, sorry.
I can't blow it.
Because of the, no, you can't.
Something could come from my mouth or something?
Yes, because a lot of microbes.
I'm blowing the coronavirus.
So, this is wearing of the second glove. You can see that my hand is not touching my own body.
Oh, okay.
So, this is how to wear the gloves, and then you are done with wearing of the gloves. And the standard is if I go about touching one or two things here, up to the camera and the chair and everywhere, the standard is as I come back, you have to discard it. But you see, because of ignorance, people wear it to the markets, from there to church. They come back all manner of, they go to places and you can even see, as you can see now, it's not dirty. But they will come back, the glove will turn black, and they will use it to touch their nose, mouth, everywhere, even to tie a tie. And they can go about with this one all day. And when you talk, they say, no, they can put hand sanitizer on it. No. There is a standard for all of this. You wear it after some time, you have touched one or two things, because within you have something in your mind you want to go and do before you put on the gloves. If you say, okay, you want to go to a shopping mall to go and pick one or two things, the moment you finish within the shopping mall, you have to remove the gloves there and then and discard it into their waste bin. That is the standard of using glove and removing. So I'm going to show you how to
Before
remove
you
the
remove,
glove.
I have a question to ask. You see, some of us are fashionistas. We are beginning to be very creative. We have Ankara face mask. We have Ankara hand gloves. Does it serve the same purpose? Because I noticed this one is polythene. The Ankara one is cotton. Will it still protect my hands?
No. The Ankara cannot protect your hand. One, if you have to trace where these Ankaras are being made, the transportation, the system, it takes for it to get to you, and the number of persons that might have passed through, these clothes the Ankara might have passed through them to get to you, the end user. You will find out that if you have a microscope there, you will be surprised the kind of microbes that you see lying there.
I don't want to look.
And they are dangerous to one's health. As I speak, I came here this morning with matches in my bag.
Matches?
I'm not coming here to set NTA on a blaze, but to to do a practical, just to practicalize something concerning this mask. Because I watch it live when a lot of masks started springing up in the market, and then the real mask. Somebody came, I think one of the foreigners, to demonstrate to us. By the time you wear this mask, as light as it could look, if you try to, and you strike matches, as light as it could be, if you try to blow it, it will not quench. But go and use Ankara mask. By the time you blow it, it will go off immediately. To tell you that there are a lot of things, not just a paper. There are a lot of things. So even when people go to say, oh, they are going to produce this, produce that, in terms of mask and then hand gloves, there are still some standards that follow suit all these ones that our people, they are not exposed to. And so we still advise them, those that can, that can afford to go buy the correct ones in the pharmacy and use.
All right, you were telling us about how to remove it.
Yes. So, the first time I used my right hand side to wear the glove first, and then followed by the left. Now, if I want to remove it, it is easy, but you have to be extra careful not to infect yourself, because you are protecting the hands. And now that I'm going to remove it, you watch me carefully the way I'm going to remove it. You can see that I have not touched anything. And now, this is how it goes. Then I will now remove this, and it's buried. So this is, for example, a waste bin is here. I drop it. I don't need to fall inside the waste bin with my glove before I can discard it.
Interesting. We learn every day. Me, I just go like this. I put my thing. We learn every day.
You are trying.
At least I remember to wear it.
So by the time I discard my glove, I have to go get water, running water, and liquid soap to wash off. Especially, they are saying we should use our hand. This corona, if you sneeze, you use your elbow to receive it, or to, limit it within yourself. And so people go to wash hand. You see them washing from here. What happened to your elbow? The washing is supposed to be, this time we are supposed to be wearing something like I'm wearing a short, with the one with short sleeve like this, so that you can wash at least an inch above the elbow, and you wash down. Wash down, demonstrate, and then wash down. And if you have a sanitizer like I do, you can as well sanitize.
All right,
your
we
hand.
learn, and it's quite interesting to know that a lot of times I've done the wrong thing, and I'm not ashamed to admit it, because I'm sure there are a lot of people who were doing the same as I'm doing. So all of us are learning. But I moved back to Dr. Kechi, and when you talked about the door-to-door distribution, I quickly remembered social distancing, that it will go a long way to help. And then I also remembered, equity. It will go a long way to help. I need you to speak more on that again.
I will. I mean, that is, all of it is part of what I meant when I said efficiency. You need to improve the efficiency of the distribution. Door to door would ensure that each household gets, people don't double get, And also, like you said, they stay in their homes, they don't contaminate. The only potential risk is for the people going to give it to them, but they will take all due precautions in doing so. So absolutely. And like I said, overwhelmingly, many of the people out there themselves, the potential beneficiaries, felt that was the way it would be fair and it would get to them, and that they all live in sort of communities where people know each other. So can identify homes and it can be distributed.
All right, your final advice to Nigerians at this point, especially on, ways to help each other.
Yeah, absolutely. Because I had said one, expansion of the support. There are, again, I am grateful to the many, many civil society and religious organizations that are out there trying to do their best. But it is still very far from being adequate. And so at every level, we need to ramp up that effort. I call passionately to the government, at the federal level. We appreciate the gestures so far made. I listened to the issue of conditional cash transfer. My passionate plea, is that let it not be too little too late. It needs to happen now.
It needs to happen.
The states level need to vamp up. But let me make a passionate appeal to every one of us.
We don't have much of a time again.
Yeah, that is a pity because really, this is everybody's effort.
Yes.
Let me say two things quickly.
Okay,
one,
my director is actually on my neck. I wish we had more time, seriously. But then Dr. Kechi is she's a family member right now. I can probably say that. So she's going to come again and speak on your thoughts. For now, we will say goodbye. And our email address is still open, of course. Our Facebook is there. You can always reach us with your comments. I'll respond to that, behind camera. For now, bye-bye.
COVID-19 transmission is mostly through droplets from sneezing and saliva. The most effective way to protect yourself from the virus is to practice good personal hygiene. Wash hands with soap under running water or use an alcohol-based sanitizer if water is not available. Maintain at least 2 meters distance between yourself and anyone who is coughing or sneezing. Cover your mouth and nose with your elbow or tissue when you cough or sneeze. Dispose of the used tissue immediately. If you have traveled recently to a country with COVID-19 outbreak in the last 14 days and you have a fever, cough, or breathing difficulty, call NCDC toll-free numbers before going to the hospital. This message is from the National Orientation Agency.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.